If you've been dealing with urinary symptoms, there may be treatments that you've never heard of before. And now we are joined by Dr. Wusu with the Advanced Urology Center for Robotic Surgery. Thanks for joining us.
I'm glad to be here.
And now tell us a little bit about your specialty.
So I'm a urologist, which means that we deal with anything related to the urinary system, all the way from the kidney down to the bladder and to the urinary system. And that includes any conditions such as cancers affecting any of those organs, to prostate cancer, to any urinary issues, whether it's urinary leakage or urinary blockages for both men and women, and as well as kidney stones.
Yeah, and so of course, like you said, these could happen to both men and women. But what we really want to dive into today is men having these symptoms.
And one of the things that I always say is that men don't tend to pay attention to their symptoms as much. And so even when it's happening and they kind of notice it, they tend to ignore it. And usually when it comes to the urination, it starts with slow urination, can't pee, takes a long time to pee, blood in the urine. All of those symptoms are things that can happen in men, and they just push it to the side or ignore it, and that's really not a good thing to do.
Yeah, because then that's when it would just keep getting worse.
That is correct. And one of the benefits of doing this, and when you see this symptoms seen a urologist early on, is that a lot of these conditions are things that we can actually take care of and often cure them, and then you can go about living your life.
And now, is there a reason for men to come into your practice before this even happens? Like you're saying, is there a way that they prevent this?
In general, all of us are supposed to be seeing our primary doctors, and that's something that men don't do very well with, and that is a starting point. Men are supposed to be seeing their primary care doctors, and they're supposed to be getting their routine blood tests and everything. So if they have any urination symptoms, waking up too much at night to pee, they mention it to their primary doctor, or they have blood in their urine when they go to their primary doctor and they check their urine. Or if they see their primary care doctor, they check a blood test called a PSA to check the overall health of the prostate. All of those things that can help the primary care doctor identify who needs to see a urologist and who does not.
Yeah. And now let's talk about the new innovative ways that you guys are treating certain conditions.
Yes. So enlarged prostate is one of the most common common conditions in men. All of us men, we have prostates. As we get older, unfortunately, the prostate enlarges. The prostate is located in an area when we urinate, it goes through the middle of the prostate. So imagine that when the prostate is getting bigger, it is basically putting a squeeze on the tube that men are peeing through. When that enlargement happens, it could long-term have significant effects on the bladder and the way the bladder works. And so there are conditions that we call enlarged prostate or BPH that men see a urologist for, and we have many different ways of taking care of this condition.
Yeah, and something that everyone is doing nowadays is implementing robotics.
That is correct.
And let's talk a little bit about that.
So imagine that a man comes to see us, and we do the necessary tests and blood work and imaging, and they find out that they have enlarged prostate. Once we identify, is this because of cancer or is it because of enlarged prostate, which is a benign condition? If it is cancer, we have robotic surgery that we do, minimally invasive surgery that men recover faster for. We are able to do that to cure prostate cancers, assuming again we find it early on. And then we have the enlargement, where we have technologies such as aquablation to basically treat enlarged prostate. It's a robotic way of kind of doing surgery that used to be done in the past, but with more precision and more accuracy, so that there is less side effects, and then the recovery is much easier.
Yeah, I mean, just hearing about these robotics, it seems it is helping the world of these surgeries, it's more precise.
It is, and sometimes what I try to despair is that when people hear robotics, they think robots are taking over the world. This is actually not the case. This is a little bit different in the sense that we are using the benefits of robotic technology. I am the surgeon, so I am still doing the surgery, but I'm using the benefits of robotics to be able to do something minimally invasive, like small 10 little incisions, or sometimes no incision at all, when in the past would have to cut you open and put my big hands in there to be able to do that. So that's the benefit, is that we are using these technologies to help us do the same things that we used to do, but in a much more efficient way and in a much more less burden on the patients. So
amazing. And now let's talk about your practice. I know you have 2 different locations. Are you taking new patients?
Yes, we are taking new patients. We are part of the Advanced Urology. It's the Center for Robotic Surgery. And we have offices in Leland and Whiteville, and we are taking new patients in both locations. And so you are welcome to call us and come see us anytime, and we'll be happy to take care of you.
Now, what are other conditions that tend to be common in men?
As urologists, we also deal with erectile dysfunction, and that is something that often doesn't get discussed enough. But once you get to see a urologist, these are conditions that we take care of in many different forms with either using medications or surgical intervention. So that's one of those things that men are more comfortable talking to a urologist about.
Amazing. Now, whether you have symptoms or not, it is always a great idea to talk to your primary doctor to see if you need to see a urologist like Dr. O here. Thanks for joining us.
Thank you.